Hello, everyone. Good day, good evening. It's, it's a pleasure to have each and every one of you join us for yet another special edition of the Mental Health Symposium. If you're joining us for the first time, I think I've seen some new names. You're warmly welcome. It's my pleasure to welcome you to the Mental Health Symposium. It's proudly sponsored by Prime Unique Women Initiative, PUI, a non-governmental organization that is focused primarily on the empowerment, enlightenment, sensitization of women and girl child. So I would like to welcome you on two bases. First, for joining us for this mental health workshop. And of course, if you're joining us for the first time, if you're joining us from our just concluded on-site workshop, for those who are in Abuja, then this is another special welcome and of course a special recognition. It was a pleasure to get to meet some of the people that we've always had this conversation with online virtually, but to finally get to see them in person earlier this month at the Merit House Abuja. It was indeed a good pleasure to carry this conversation from Zoom to an on-site workshop. So that is me giving you a special welcome from that on-site workshop. Now we're about to continue the conversation. Of course, it's another part of mental health conversation, but it still revolves around the same narrative about how each and every one of us has a part to play in making sure that we are better humans and in making sure that we are able to help other people to become better humans as well. I am not alone in this room. In fact, I'd like to especially welcome and recognize the presence of a distinguished president, the president and founder of Prime Unique Women Initiative. I'm referring to Dr. Mrs. Folake Yoba. Please give her your undivided attention as she warmly welcomes each and every one of you to this program. Dr. Folake, please.
Hello, good evening, good people. Trust we're all doing fine today. It's nice to have you back again on this Zoom program, our webinar. We've been handling this program for many months now, indeed years, and that is because we want to impact in the lives of all of us positively. Mental health is something that we have found very germane at this point and every time, because actually most of the problems that people have in the world today, particularly our dear country Nigeria, could be attributed to issues around mental health. From the statistics from WHO, we've been told that about 40 million Nigerians actually live with so many different types of mental health issues. So because as a result of that, we are very passionate about this because we believe that, yes, we can make a positive impact in the lives of people by letting all of us get to know what we talk about when we mention mental health. Contrary to what people think, that when you talk of mental health, then it's somebody that is raving mad on the street. No, that's the very extreme part of it. That's not what we're talking about. We are talking of those of us who are still well dressed, but have all sorts of mental health challenges, perhaps known to some of us and others not known to them. And it becomes a big problem when you have a problem, you don't even know you have it. So that's why we call attention of our friends and our listeners to this program, which takes place fortnightly. So we had this 2 weeks ago, we're having it now. In the next 2 weeks, to the glory of God, we are going to be talking about other topics that will be very relevant to all of us and most of us. So, well, and as God will have it, just last week, we had a full workshop on this program, and we really handled, and we had resource persons who actually trained us on so many beautiful things about awareness on of our mental health status and how we can take care of ourselves when we find anything that is missing in our mental health, and how to watch out for signs in our children, how to make sure that our children stay away from drugs and even adults stay away from drugs, and also poor dieting could also be a cause of mental health issue. All of these things we learned extensively. And also on this platform, we've treated a lot of topics too that will help us to be able to be better people, to be better neighbors, better parents, better children, and also useful to ourselves, our society, and the community at large, and our nation. And then today, we are not going to do anything less than what we've been doing. As a matter of fact, we are stepping up again because we have in-house too, very powerful resource persons, those who are specialists in what they do, who have taken their time to actually learn and know their onions in these fields that we're about to talk about.
Okay, I believe everybody can hear us. Are we good?
Yes, we can.
Okay, welcome, Dr. Ninnah. It's a pleasure to have you. And our resource person is in the room. I saw her just a minute ago. Madam Okara, YG. Okay, so that means we're good to go. So Dr. Ninnah, over to you, please. Would you please introduce our resource speaker for today?
Okay. Can you hear me clearly?
Yes, we can hear you now. Thank you.
All right, thank you. I'm happy to be up and doing again. I've been sick for some time, so and this is a very interesting topic. We've been doing this for the past let's say how many weeks now? For the past 2 or 3 months, and it's an interesting topic. So I will be talking to us this evening about is a breakdown of different poor mental health conditions. And I would not take a lot of our time. I think in the next 30 minutes, I'll be done so that I'll give time to other people to also talk and share their stories. I'm sure by that time, Dr. Yuba will be back online. And so breakdown of different poor mental health. An overview of a poor mental health. A poor mental health condition is a state of psychological or emotional distress. So I purposely put these two words in italics, psychological or emotional, that signifies impacts, that significantly impacts an individual's ability to function in daily life. So we can also say is a disruption in mood, thinking, behavior, perception. Sorry, I'm trying to, using a new laptop, so I'm trying to get used to. All right, so the goal of this meeting actually is to provide an overview of different type of poor mental health conditions, their symptoms, and their impact, as well as to discuss the potential causes and contributing factor for each condition. Okay. All right, this is nice now. So why should we know quality of life. Effective treatment can significantly improve an individual's quality of life and allow us to function more effectively. Also, if we know the essence and the different type of mental health, it can also help in preventing complications. It can also provide individuals with coping strategies, support system, and treatment option as well. So impact of poor mental health, the person will be emotionally distressed, impaired functioning, like you lose productivity in everything you're doing, in your schooling, or even at your workplace. You have behavioral changes, cognitive impairment. When we say cognitive impairment, you're not able to make decisions, you're not able to recognize anything, you're not able to function, your mind is not able to function. So we also have physical symptoms, and this can also strain in your relationship. So type of poor mental health and their possible causes. We have mood disorder. A mood disorder is a type of mental health condition that's characterized by significant disturbances in someone's or in a person's emotional state. And then we have the sustained emotional highs. We also call it mania. The hypomania. We also have when your mood is low, which is depression. We can also have it when you have a combination of both. This can also affect an individual's ability to function effectively in their daily life. So let's dwell a little bit on major depression disorder. That's the MDD, which is on the extreme, emotional extreme and excessive elation. The symptom is this: you have persistent feeling of sadness, you're always sad, you feel hopeless, like you think you're not good enough for yourself, this kind of hopelessness, this kind of emptiness, your loss of interest in activities, the things you used to enjoy before, you no longer enjoy them, there's change in appetite, you don't want to sleep, you don't want to eat, you can't sleep, you're always tired, you can't even concentrate. And the extremes of MDD is this: you just start thinking of suicide. So the impact is that it can lead to significant impairment in your daily functioning, like we say, and your social relationship. Then we also have the bipolar disorder. It's a serious mental illness that's characterized by extreme mood swing. It can be extreme, right? So the symptom is you always have your alternating period of, hypomania, the increased activity, and reduced need of sleep and all that. The impact is the mood swing, which can also cause serious disruption in life. It can also affect your job performances and your daily responsibility, including your relationship. Now we talk about depression, which a lot of people know, and we know is a mood disorder that causes persistent feeling of sadness, like your emptiness, you don't have joy, you are sad, loss of interest, worthlessness, you feel you're not worthy, you feel guilt, difficulties in also concentrating. And some of the causes could be prolonged stress, traumatic events from the past, and all that. Don't forget, we are talking about different type of mental health disorder. We also have the cyclothymic disorder, which means that you're always fluctuating. It means you can see somebody in the morning, the person is happy, before the next minute, the person is sad. So it is chronic, like it's a mood disturbance. Sometimes it's periodic, sometimes you are depressed, sometimes you are happy, sometimes, you're not stable, you're emotionally not balanced. We also have persistent depressive disorder, which is the PDD. In this case, is kind of a chronic depression with less severe, but is long lasting. Somebody can be depressed for a long time and you don't get someone who goes to work and you can notice that this person no longer perform as usual for several times. This kind of disorder, these people don't come out of it quickly. So it's actually a long-lasting, it has this long-lasting symptom, a continuous feeling of sadness. Continuously, you are sad, and you feel hopeless. It affects the overall quality of your life and functioning. And possible causes of mood disorder, it could be genetic predisposition. It could also be biochemical imbalance. It could be prolonged stress, traumatic event, something that happened to you in the past. It could also be as a result of high expectation of life, and which means sometimes you feel you're not getting there, too much expectation. You look at your mates, they are ahead of you, either in marriage, professional, and then you go into traumatic, you go into disorder. It could also be something that happened to you when you were in your childhood, and then you couldn't get over it. So it's affecting your adulthood. So sometimes it could also be a certain medical condition or medication. There's also something we call anxiety disorder. And the symptom of anxiety disorder is restlessness. Restlessness, you feel this kind of unworthiness, fatigue, irritability. Every little thing you're shouting, you know. The possible causes could be genetic also, an environmental factor. We also have panic disorder. I don't know if you've met people who are always panicking, even the little things that are not supposed to make them panic. They're always afraid. They're every little thing, the noise, a little noise, even the generator noise can make them, this is called panic disorder. Or even blowing of horn. They're always, their heart is just jumping out. So you don't make noise where they are. This could be kind of recurrent panic attack, sudden period of intense fear, discomfort, which always cause them to have chest pain. Some people that will tell you, they don't shout where this person is. Once you shout, they go into panic. Their heart starts palpitating. They start having shortness of breath. Everything gets them so scared. So this could also be a genetic predisposition. It could also be as a result of significant stress or certain change in brain function. We also have social anxiety disorder, intense fear of social or performance situation, worry about embarrassment, when you think other people are doing better than you. So this kind of people, you see, they avoid gathering. They're always in their hole, in their space. They don't want to come out. They feel they are not enough. It's not like they don't know how to speak English, but once they come out, you see them they muttering. They can't even say a word. They just go into anxiety. This could also be as a result of environmental influence or possibly early childhood experience. This also happened to children when you're always shouting on the kids, making them using emotional word or bad word, negative word, making them feel they are not enough. So they don't want to try new things. So you see that they grow up feeling that they are not enough. They grow up with intense fear of socializing. So this, and it remains with them like that. It remains in their head and cause them what we call social anxiety disorder. And this one we also know with the psychotic disorder, the schizophrenia. This is when people start talking to themselves, they start hallucinating, kind of delusion. They have disorganized thinking, speech, some kind of abnormal motor behavior. So this could also be a genetic predisposition, some kind of brain abnormality. This is when this is the extreme of it. This is when we say people are going crazy or people are going mental or something. So it could also be a prenatal exposure to infection, malnutrition, some kind of significant early life stress or trauma. We also have eating disorder. I don't know how many of us have followed this doctor now. You see people weighing like 700 pounds and they can't stop eating. They tell you they can't stop eating. They know it's going to kill them, but they just can't stop eating. So this is a mental health issue. It's an eating disorder. But in this eating disorder, we have two types. We have the anorexia and we have the bulimia nervosa. So the first one is this: people don't want to eat. They're having ulcer, but they don't want to eat. They have this intense fear of gaining weight. Every food, they have to check the container to know how many calories. So it affects, there are people like that, they just want to remain in one size and dangerously lose weight. So the possible cause of this, it could be genetic, it could also be societal and cultural pressure. You know, society will tell you slim people are in vogue. Slim person, that they are the model for every beautiful girl, you need to be slim. So it could be societal, it could also be cultural pressure and perfectionism. They want to be perfect with what they eat. You know, they want to be in one shape, and they think if they are out of this shape, they are no longer beautiful. Men will no longer want them. So it's a kind of mental disorder. And for the other people, they want to eat. They feel, when you follow that program of Dr. Now, most of their story is either my mother did this to me, or I was depressed. So the only joy I have is food. So the only comfort is food. And they start eating and eating and eating, and it causes them, and they become overweight, and they can no longer control it. All these things are various kind of disorders. And we have personality disorder, borderline personality disorder, BPD. These people have unstable relationship, they have intense emotion, and they have fear of abandonment. They can also afflict themselves. In school in those days, I know of a girl who likes to hurt herself. They like to inflict themselves. So when you look at her body, you see all manner of scars, razor, needle. They find joy, they derive joy in seeing themselves hurt. So I don't know what kind of disorder is that. Each time you see her, she's having a needle or she's having a razor blade. She likes to see somebody bleed. She likes to see herself. She likes to inflict herself. I don't know what that is, but during the course of this program, I realized that most of all these things are disorder. So this could be as a result of I think something that have happened out of guilt, and they think they feel so guilty of something, and they think they want to inflict themselves. So genetic influence could also be as a result of brain structure and function. It could be, childhood trauma. Some of them feel there's something they should have prevented in the past and they did not do it. So they grow up with this kind of guilt, and you see them inflicting themselves. It's a kind of mental disorder. So we also have antisocial personality disorder. These people, they are so aggressive. They don't have remorse. That's why you see some of them, you see most of all these people, and you are wondering, what is wrong with this person? The person is doing something and they don't have any remorse. They don't know if it is, they don't think it is good. And you are explaining to this person that what you are doing is wrong, and they don't think it is wrong. They don't think there's anything wrong about what they are doing. So Dr. Yoba one day said that that she really thinks that these politicians have personality disorder, because if not, how can you how can you have disregard for other people's rights? And you are eating so much money, you are packing so much money that can feed a whole nation in an African country. That's one person will pack without any kind of remorse. And when you catch them, they don't feel any kind of remorse. They think it is their right or it is what they should do. So their morality, when you see people having dead conscience, their conscience is dead whatsoever. You take money and you keep eating, you keep saving to the extent that you have to dig a septic tank, a soccer well like we call, to pack all this money. You have enough. You can't give another person. And for some people also, there are people that they can't give you, they won't eat it, and they will keep that thing until it gets bad and they throw it away. So it's a kind of mental disorder. You won't eat it, you have food, you won't eat it, you won't share, you won't give to another person, and then you wait until that food gets bad and you throw it away. So I think it's a kind of disorder, and they lack remorse about it. It's a kind of disorder. So we also have neurodevelopmental disorder, which is the autism, the ASD. And you know what the symptom is: challenges with social interaction, communication, difficulties, restricted interest, and repetitive behavior. This could also be genetic factor, prenatal and perinatal influences, some kind of early development disruption. We also have the ADHD, which is an attention deficit disorder, the hyperactivity disorder. Some children have this. They are never paying attention. They don't pay attention to anything. They have low attention span. They can't sit like this for 5 minutes. They want to be jumping up and down. They can't even stay in class. Once they're in class, they go out. They will be walking around the school. They can't sit down one place. So it is early enough that we know all this kind of disorder and we know how to tackle them. So you see your child does not pay attention, your child cannot sit down one place and watch TV for 5 minutes. So these people have what we call ADHD. So we also have the trauma and stressor related disorder. This PTSD is a post-traumatic stress disorder where you have flashback, you have nightmare, you have severe anxiety, uncontrollable thoughts of traumatic events, things that have happened, So the possible causes could be when somebody is exposed to severe trauma. It can also be inadequate post-trauma support. Then we have what we call the OCD, like we discussed. These OCD people, they are perfectionists. When there are people that when you keep this phone here and somebody comes inside, you touch the phone, they know. So even as little as coming into the house with your slippers is a big problem to them. So these people have issue with relationship because they always want their things to be like that. Don't touch my clothes, don't touch this paper. If you come into their room, I have a friend like that, don't sweep for them. If you come into the room and you see papers, litters all over the place, leave it like that for them. If you touch it, every littered paper have a significance. So leave it like that for them. If you touch it, you are going to have problem with them. So sometimes it could be hereditary factor also. It could also be as a result of stress and trauma in life. So how do we seek help, ladies and gentlemen? The essence of this talk tonight is some people are having issues and they don't even know that they're having some form of disorder. Some people, like I was recently telling someone that my birthday is on 22nd and I told the person, I just feel angry, I'm sick. During my birthdays, I fall sick, I'm moody, I'm depressed. And during the course of this study, I began to ask myself, why over the years, why is it that over the years I'm always depressed, I'm always moody during my birthday? And I discovered is some form of disorder that has to do with life expectancy. You feel, okay, at this age, I'm supposed to be like this. Then it is over the years, you have written your goals. You have written things you should do, your goals that you should have achieved at this age, and they're not forthcoming. So it's a constant reminder of what you have not achieved, of what you're supposed to do and that you've not done. So it makes you angry, makes you sad. So what you have to do sometimes is you just keep talking to yourself. You have some kind of, so for this past few days, I've been doing self-meditations. You are meditating, you are encouraging yourself. You're looking back at the little things you have achieved and you are being grateful. You practice gratitude. So why should we seek help? So if you don't know, we say ignorance is a disease. If you do not know why things are happening to you, then you will keep dwelling in them and it's going to damage a lot of life activity for you. So for your mood disorder, you meet a therapy. For bipolar disorder, you can also meet a therapy, a psychoeducation to manage your mood swing. You can also talk to somebody. You can also maintain a regular routine, exercise, meet people, and even talk to your friends about it. You can also ask for medication. But the problem is when people are having bipolar disorder, they feel, okay, why are they giving me medicine? Am I mad? I don't want to talk to people. They might think I'm going crazy. So it's a kind of stigma. They don't want to talk about it. They don't even want to take this medication. They feel it is medicine for psychiatric people. So, but I think it's not. There's always nothing bad in trying to seek help. There's nothing bad in trying to talk to somebody about how you feel. The anxiety disorder, you can also meet a therapy to even address. There's something we call anxiety triggers. So there are also anxiety medications. You can also practice mindfulness. You can also meditate about the things that you have achieved. You can also celebrate yourself about the little wins. You can also assess your community or support group and some therapy, some coaches about how you feel. You talk about it. We usually say that a problem talked is almost is a problem half solved. So we have panic disorder. For every of this help, you will see that they are always telling you to talk to a therapist who can always manage panic attacks. It's okay to talk to therapists. I don't feel okay. I need to talk to somebody about it. So it is very bad to bottle all these things together. And then you keep them in your heart, you're getting depressed, your relationship is not working, you're not meeting relationship coaches, you're just keeping it, you don't want to share so that people will not talk about you, or you are dying in silence. You're having financial issues, you are dying in silence, you don't want to talk to anybody, don't want to ask for help. So I know of all this. I think it's Mona, this Nigerian actor, that had issue and he didn't want to talk to anybody about it. He thinks he will be ashamed to come online to ask people for how much is it then. It wasn't even a huge amount, but he just feels, I don't want to come out. I don't want to start asking people for money. I'm a big boy. I have this perceived value. I don't want to come share my problem. But for crying out loud, who knows? One person can even take up this issue and even help you with it. I think he was looking for visa to India or something. He didn't want to talk about it. And the next thing is this. We just heard on the news that he's dead. And then his wife came up or his siblings came up to say, oh, we asked him to say it, but he refused. He was ashamed. So if you're ashamed to talk about these things, or you're having failed marriage, divorce, you lost someone and you're dying in silence, or you feel you're not even, you feel you're not getting to your expectation, you're not even talking to your coach, you have mentors, you have brothers, you have people you can talk to, or let's say you don't even want to talk to somebody that knows you, but you have people who are very far away that you can talk to and you don't want to talk to them. You can also confide in your parents. For me, I like to talk to my father all the time about things. And that has been working over time for me. You talk to these people about these things and you get it off your chest. But some people don't want to talk about it and it affects them mentally. They start going down, they start slimming down, they're going to eating disorder, and it gets down to the extreme. Social anxiety disorder. You need to address your fears. And when you address your fear or you talk to a strategist, business strategist, or maybe a transformational coach or a developmental coach or social skill, a skill coach or something, transformation coach or whatever kind of coach, these people sit down with you and they analyze your gap analysis and they give you solution on what improvement or what social skill to improve. So you kind of what we call exposed therapy, gradual exposure to social situation. You talk to people, I don't know how to do this, I need to learn this. It is not bad to say, I don't know how to do something, but some people don't know how to do something and they don't want to talk about it. I'm a lawyer, I don't know how to draft business agreement, or I don't know how to do litigation. I don't know how to do this. Can you teach me? But you don't talk about it. And then when you open your social media page, you see some of your mates doing well, and you go into depression and you start feeling like you're not enough. So we have psychotic disorder. What should I do? So this, you have individual therapy and you also have family therapy support to support the individual. For the eating disorder, you can also meet a nutritional counselor. This one too, you can also meet a dietitian or a nutritionist to tell them, okay, the problem is people just feel ashamed to discuss their problem, but that's not the best solution. So for personality disorder, you also meet a therapist, what we call behavior therapist. They sit down and they analyze your behavior and they group it into negative and positive, and they provide skill training and solutions for you. For the antisocial personality disorder, the same thing. You meet a long-term individual therapist. Sometimes this therapist is not once, you go over sections and over sessions to modify your harmful behaviors. For the autism, people with autism or kids with autism, so they meet behavioral therapists who also specialize in education support, and this also improve their communication and daily life skills. You teach them something, they do therapy, speech therapy, and a lot of activities. For the ADHD, the same thing. They also meet behavioral management strategies. For the trauma and stressor-related disorder, they also meet therapists. For the OCD, so, you know, we talked about OCD earlier on, and we said there are people who, when they keep something, they don't want people, they want their things to be very perfect. They want perfect human being. And unfortunately for this kind of people, there's no perfect human being in the world. So it affects their relationship and they hardly have a lasting relationship. They're always finding fault. Within 2 months, they're always finding fault. So these people have obsessive, compulsive, and related disorder. So in conclusion, I want to conclude by saying this. I think I've said it before. If you think there's something wrong, your mood is changing always, and you can't help it, you should also realize that there are things that happen to you in life that you are not able to control. There are things that happen in your childhood. So you should not live with that guilt. You should not live with that trauma and think there's something you should have done about it. For some people, they dwell in their past event 10 years, 15 years, 20 years, and then other people who they meet in their future begin to bleed on these things that they should have forgotten and things that they didn't or they weren't able to control. But the thing in life is this: you see those things that you're not able to control, you leave them. There are things you can't control, and there's nothing you can do about it. For instance, someone who had a child, an autistic child, what do you want to do about it? You cannot kill yourself, but you see, they can't even manage this child because they're also going to depression. It wasn't your fault. Some things happen in life, and sometimes we can't even question God. We can't even question why it happened. And then for people who are always anxious, people who have anxiety disorder, they have a short focus. Why I said that is because they don't look into the future to realize that things can always be better. So if things are not happening right now, you're very sure, be very optimistic that it can happen tomorrow. Someone can be poor today and can be opportune tomorrow. Person can be poor today and be rich tomorrow. So what should that person do? The person have to be hopeful. For some people who dwell in hopelessness, and that being in hopelessness or taking drugs or taking alcohol will not help the issue. So what helps issue is when you sit down, you analyze the problem and you ask yourself, what next? What should I do next? How should I treat this problem? I think is a better approach than dwelling in depression dwelling in mood swing, blaming yourself, feeling guilty, something you cannot change. And most of all, when you can't even help your situation, there's nothing shameful in talking about it and in seeing a therapist. I think I've talked so much. Ladies and gentlemen, I'll be ending my presentation here, and then we'll be having open discussion and questions to talk about our personal story. If you have something to talk about, if you have how we can reduce misconception, the stigma, how we can also support each other, please feel free to raise your hand and ask your question. Felix, are you there? I'm done. Thank you.
Thank you so much, Dr. Pastor Ninnah. It's always a pleasure to hear you speak. In fact, I totally lost track of time. Well done. Very good presentation. One thing I particularly loved about your presentation is the fact that aside mentioning the different breakdown of different mental health conditions, you also provide solutions. And one thing that stood out for all the recommendations that you gave is that it's very important for us to seek help. And of course, that help can come from different places, right? As you have clearly demonstrated. So these are some things that I think each and every one of us should keep in mind, because as we have always seen from most of our presentations, talk is not enough. Talk is not enough. We want to take the needed action. But then, just like Pastor Ninnah said, I'd like to find out, does anybody have a question, a contribution, a concern, something that they would like to share, so that we can go ahead and address them in the next couple of minutes, because this program is supposed to be for 1 hour or less. Any questions or contributions from anyone?
Oh, thank you so much, Felix.
Yes, ma'am.
Thank you, Dr. Ninnah. We always appreciate you. You're always there to help people. You take delight in doing this, and we appreciate it. And I know God will appreciate you for this as well. Thank you so much. You see, behind the scene, many people have talked to us. Many people have approached us, and sometimes they don't want to come to the open. So we just wish to let you know that if you have anything to say, you may put off your camera. You don't need to mention your name. Maybe others will learn from your experience, and there may be solutions on this platform. And apart from that, if there are questions, please feel free to ask. Thank you, Felix. So look out for hands, and let's see those who are raising their hands.
Okay, ma'am, that's fine.
Sorry, Felix, I can see Professor FD is here, and also Rukaya is here. You remember Rukaya? She was on this program, I think, some weeks ago. And I can also see Ben Elezu here from America. And we have a lot of specialists in the room. So we would like to hear from all of us. So please. Dr. Rukaya, please, you can take the floor if you have something to say.
Good evening, Dr. Ninnah. Good evening.
Good evening.
Dr. Ninnah, thank you so much for that, your presentation. And I really appreciate the presentation. But one thing I think about is that it's better to nip this thing in the bud. Like knowing quite well that human being is a product of nature and nurture. You can see that in the presentation, most of the conditions are attached to emotional factor or genetics, or you keep on mentioning genetic factor, genetics. That, as well as their way of life, which is from an environment. I think one way our forefathers used to take care of this in the past has been that investigation even before marriage. You see, that they know if there's a disease condition or something that runs in a family, so that they'll be able to counsel people properly. Because if most of the mental conditions has to do with the genetic influence, then we should take care of that at the beginning. And I think this will help. aiming at preventing the occurrence of this. Like you rightly said, if one is ready to seek for help and accept help, the problem is half solved, from that. And you also mentioned that there's no need to worry about things you cannot solve. Like that musician from South Africa sang a song that she doesn't have to worry about things she cannot solve. I think we should only bother about what is left and forge ahead, seek help at all times. And you might be shocked that what you take to be a problem might just be something that somebody somewhere there can really put in something. Thank you so much. I really appreciate your presentation. Thank you, Madam. Dr. Ninnah, thank you.
Yeah, thank you so much. So while we're waiting for more comments, I'd just like to quickly read this one that says, how can a person deal with a foggy brain, mood swings, depression, worry, and anxiety that has passed for far too long, over 10 years? So I'm assuming that is addressed by Ninnah and of course to the other experts and professionals of that.
Okay. I'm trying to get that question again. Okay, so how can a person deal with foggy brain, mood swing, depression, worry, anxiety that has passed for too long? So I'm going to let Ruqayyah to answer that question.
Good evening, everyone. I'm happy to be here again. So, mental health, I think it should be the most important discussion everywhere, even at the motor park. Because from the question, the person said, how can a person deal with a foggy brain, mood swing, depression, worry, anxiety have passed for too long, over 10 years? And we all know that whatever that keep reoccurring have become a peculiar problem. So now we need to know the causes of the anxiety first. You need to know the causes. You need a therapist to ask you, how does it started? When does it started? What was the event that happened before it started? And is it a genetical problem? Just like Barrister Ninnah rightly said, is it a genetical problem? There are some family that they are angry people. In fact, when you even want to visit them, everybody tell you that they are angry people, they don't really laugh. So this can be a genetical problem with the person. But it can also be, it will be a post-traumatic disorder, like people who have been bullied in the past. Some people, when they were in school, they face a lot of bully at workplace, stigma. Their brain, have actually settled. The brain has been rewired to know that everything is an attack. So even if they see someone shout, they are going to react so negatively to it. So this person now, we cannot conclude the causes of your depression. We can't conclude what happened, but whatsoever, even over 10 years, can be managed. There is a talking therapy, there is medication, so many classes of therapy that can be used to manage the person. So whoever you are, I am telling you that you just have to speak out. Diagnose, the person will diagnose what causes this, how does it start, and is it something that, and the right therapy, the right approach to do, to start with. So you can reach out to Dr. Ninnah. She can help you with any therapies to start with. You don't have to live with it. It's not something you have to live with. You have to stop it or manage it. Thank you.
Yes, ma'am. Okay, thank you so much, everyone. Thank you. I'm just waiting to see if there's one more question. so that I can officially hand over to our president, Frank William. Most of us are aware that this program is sponsored by.
Okay, Felix.
Okay, ma, please go ahead.
Oh, Felix.
Yes, ma, we
Okay.
can hear you. Please go ahead. Yeah.
No, I'm just trying to say that you should take note of the person that asked that question. Yes, take note of the person that asked that question so that we can advise the person to see us after. I mean, contact us, talk to you after the program so that we'll see how to run the person and look for solutions to the problem after the program. Did you hear that, Felix?
Yes, ma, I got that. Thank you so much, ma.
Hello, Felix.
Yes, ma. Yes, I got it. Thank you so much.
Can you hear me?
Yes, ma. I can hear you. I think it's
Dr. Ninnah?
I can hear you,
Okay,
Ma. We
okay,
can
so
hear you.
let's
We've
look
taken
for
note
more-
of that.
Okay, all right. So let's look for more hands here.
Hello, everyone. Can I talk? Just say a little one or two stops.
Okay, thank you. So,
Okay.
is there any other question or comments?
This is just like a comment. Hello?
Oh, sure.
Please go ahead, Chooks. Go ahead, please.
Yes. Sorry, my video is blurred. So my name is Ben. And
Please go ahead, please.
okay, so my name is Ben, and I got invited. I got to see this link through Dr. Ninnah's Facebook page, and I live here in the United States. I just concluded with my BSN program in Bachelor's of Nursing then, and I was one of the best graduating students for the whole university. I concluded the program with a 4.0 GPA. So, and I have a very huge interest in mental health, and that was the reason why I decided to attend this meeting.
Wow. Okay.
And I've always had a passion, like each time I come back home, I will try to educate people more on mental health issues. I was one of the best students on mental health subjects. So I kind of like feel back home here, back in Nigeria, one of the major problem is the stigma behind mental health issues. Like people need to understand that mental health is just like where people normally have like a headache, stomach, just like a normal disease that people normally have. Then it just depends on how it disturbs your daily of maybe activities of daily living. So like I think people needs to know that mental health is just like a normal disease first, and don't have this stigma about it. Like when someone is having like a mental breakdown, maybe the person is being regarded as being possessed or maybe being like a spiritual attack or something like that. Like people need to understand it is normal. Everyone goes through a mental breakdown at any certain time of their life and days, but it just depends on how you manage yours. So some people are not good in managing their stress and mental breakdown. So one of the major points is like people need to know it's normal to have a mental breakdown and there is help. So this is the little stuff I have to contribute now. I hope to be attending more meetings and have more information on every mental health disorder that has been discussed here today. Thank you, everyone.
Thank you, Ben. Thank you
Thank
for
you so
joining.
much. Thank you so much. Thank you so much, Ben, and congratulations. I know Nigerians are doing well all over the world, and we are so proud of you. Thank you. Please, let's keep working together. We appreciate people like you who actually know the importance of people being mentally stable and having doing away with whatever mental health issues that they have. And like you said, we have always said this too to everybody, that nobody should see it as anything that is totally odd or out of place, because you have malaria, you have headache, you have a cold, any form of cold or whatever it is you have in any part of your body. You can actually have a sickness in your brain as well. So nobody should stigmatize the other person. The most important thing is that we need to identify the problems that we have so that we can get solutions. And there are always solutions to all this problem. Hello, Felix.
So I think Dr. Yoba is either the network is not being friendly. Felix, are you there?
If he's not available, please, can you see the hands that are up so that you can call?
Yes, please.
Call them
So we're having
yeah.
mind switch. I think this mind switch is Nebe. Nebe, are you there? I think Nebe is a clinical psychologist.
Good evening. Good evening, ma.
Okay.
Good evening, ma.
Thank you.
I'm present. Yes. Good evening, everyone.
Good evening.
Yeah. Okay. First of all, I want to say it was a very, very worthwhile symposium and presentation. Congratulations, ma. You did very well, and we're learning from you. Well, there's actually a lot to say rather when it comes to mental health issues. The truth is, let me talk from personal experience. I believe that I also have my fair share, but from the onset, I've looked a tough mind or a tough skin, so I really don't allow negative things to get to me that much. I just have to swoop and keep going. I see it as a part of the process. One thing I want to put at the front line this evening is this. We are now beginning to face out pain, difficulties, challenges. People are wanting to disregard challenges, pain, and difficulties as part of the process of life process. And when such things or challenges or difficulties come up, we find it very difficult to adjust. I am saying this because in 2015, while I was still on campus at the University of Ibadan, I lost my mom from unknown illness. And because I had to want to take the of the operation that she was made on her but I was trying to see my mom die, but I could do nothing else, something of that sort. Then, if I'm talking about myself, who was really mature to certain about my sisters, where they went on to graduate from universities, and one of them, she's in Poland right now. Something about technology, and God job again. So I had two sisters. They had to face. They were young, very young, and I'm saying this all those some days. My dad just stand by the window and he'll just be staring. You see that he has traveled far in his thoughts. He's thinking. Hello?
We can hear you. Yes, please go ahead.
Yes, so sometimes he's just staring at the window from there to solve it. And so we devised a mechanism. We all rally around him, and just create some kind of gestures that will make him to be happy and to be cheered up and forget about the experience. But it's all stretch, then I just gradually. So the matter of ground is this: mental health actually a very, very serious thing that we all should pay close attention to. I think is that we should learn to embrace pain, see pain as a natural process, realizing a better outcome. So I want to thank everyone for being in attendance, and I want to thank Dr. Ninnah. I thank you, Dr. for the privilege and opportunity to be here. I long to be an active participant of this process, and long run, we'll be doing great things together. Very much.
Okay, thank you so much. Thank you so much. Felix, are you in? Felix, are you back in? Oh, Dr. Ninnah.
Yes, I'm here. I think Felix is having what do you call it now? Network issue.
Okay, obviously. Okay,
Yeah,
please.
so
Then you should
please,
call.
do we have anyone who has something to say, or any question, or any kind of contribution, some kind of insights, or how you want us to further this program in order to reach those people that don't know what mental health is about? Please, we are also eager to hear you talk to us. And I'm also at the chat room to know if there are people who want to say something or who don't want to talk, so we can also reach their
Dr.
message.
Ninnah, Dr. Ninnah, I would love to add this. Like I said, the mental health, we should try to create more awareness on mental health to the common people, the community, the market women, the school children, because even the adolescents are not spared on this mental health issue. You see, your child comes home and becomes so aggressive, and you don't even know how to handle him or her. So I think this mental health needs to be more aware. Let there be more awareness on the street, everywhere. So I am urging, if we could organize outside the electronic to the streets, to the common people. Thank you.
Thank you, Haja Rukia. I quite agree with you. I also think we should reach out to schools. You know, some of these children might be having challenges, and they don't even know what is wrong with them. So most of them find themselves in such situation where they can't even help themselves. Dr. Yoba, what do you think about it, ma'am?
Yeah, absolutely correct. We should put in efforts within and even sometimes outside our reach to ensure that we sensitize and educate people on what we're talking about. Most people, most people actually do not understand, and they need to be educated on how to stand up and also create awareness in others. As a matter of fact, for those of us who are in this meeting this evening, let's take it upon ourselves. Each person should at least talk to 10 persons about mental health consciousness. Let me put it that way. Take it upon yourself to talk to 10. If you talk to 10, and we encourage the 10 to talk to 10 others, and many more people will get to understand what we are talking about. You will not believe that up till now, many of the elites and those who are even expected to have gone through the four walls of schools and who are well read with plenty mental health, to them, you are talking of those who are raving mad on the streets. So there's so much ignorance, and we need to take it upon ourselves to talk to as many people as we can afford to talk to. And we at Prime Unique Women Initiative, we are not stopping at anything, educating people. We want to make sure that we get as many people as possible to understand what we are talking about, to understand the meaning of mental health so that they can take care of themselves and take care of people around them. And then we can have a better society, better families, and the quality of our lives too will be better when we can understand ourselves. So we are not going to stop. And we encourage every other person to do the same thing in our own little way. They say little drops of water make a mighty ocean. If all of us take this upon ourselves, we have knowledge, we give out knowledge. We are not paying for this program. In your own way, people around you, talk to them, reach out to your family members, your children, whether at home or wherever, your parents and your friends. Let them understand that they need to look at their own mental health status and see how to help themselves. Because many of these problems that are killing people today actually are attributable and connected to their mental health condition. So if we know this, we have our problems, if not half solved, significantly solved as a society and as families and as individuals. So we'll try this.
Thank you. I'd also like to quickly recognize the presence of Dr. Tariq, all the way from Istanbul.
Alex, is there any other person?
Yes. I'd like to find out if Dr. Tariq has spoken for us.
Sorry?
Yeah, Dr. Tariq is on the call.
Okay, fantastic.
Yes.
Yeah, let's have Prof.
Hi, everyone. I'm here. Yes.
I'm glad. Yes, that's good.
Okay.
Yeah, that's good. Please go ahead, Prof. Go ahead, Prof.
You want me to speak a little?
Yes, we always
Okay.
love you to. Professor Tariq is a very
Hello, everyone. Hello.
He is in the
I hope the connection will not fail me.
Talk, please. Yes.
Okay. In fact, when Clement sent me the invitation,
Yes.
I thought of a key word, a magic word, which is acceptance. Every single time we need to accept, what been offered, what we are in. We need to accept that, because without acceptance, we double the depression, we double the stress, we double the frustration and the anxiety. So the key word is acceptance. We need to accept what we are in order to manage to deal with what we have to deal with. And here I remember, I'm sure you all read about the Chinese wise man, whom all the villagers came to ask him that they are not happy and they have problems and this sort of things. So he asked them to write their problems on a piece of paper and put them in a jar and come the next day. So they did as he informed them. They came the next day and said, okay, guys, everything is solved. Everything is sorted out. No worries from now. Now you go and choose the problems you like. Now, every single one of them, of the villagers, selected his own or her own problem. They didn't dare to select or choose others' problems. So what does it mean? It means that whatever problems we have, God knows that we can handle it. We can manage these kind of problems, you see? So nothing above our abilities or above our, capabilities. No, what we are in, we can manage with it. We can deal with it. We can find solution, but we need first to accept. Acceptance is very important. And second, every single time, we need to be positive. Even if you are among the toughest situation, the most difficult problems, there is no harm at all to be positive. Nothing, you're gonna lose nothing. So when you are positive, that will allow you to think better. you know, and to avoid being a prey for frustration and, you know, nervous breakdown and this kind of sort of things. So we need to accept what we are in. We need to be positive, you see, all the time. Second, you know, we don't need to dwindle much in the past or in the future, because like the English people used to say, never cry over spilt milk. When something is spilled on the ground, if you cry till morning, are you gonna bring it back? It's done. So let bygone be bygone. So never dwindle much in the past. Whatever happened in the past, let it go. And don't dwindle much in the future, because we are not sure. Are any one of us sure of what's going to happen after 5 minutes? We don't know. So what we are absolutely sure of is our present moment. This is the only sure moment we have. So we need to first to appreciate the present moment. We are alive, we are thinking, we are using our mind, we are accepting what we are in, we are dealing with it. So this is a blessing. Okay, we are alive, we are kicking out. So it's a blessing we can manage. All right. But you know, what will happen? What will happen after 5 minutes? I don't care. I don't know, because nothing is guaranteed. All right, nothing is guaranteed. So why should you depress yourself with something unknown? You know, do you know that 90, you know, actually this is, it was, I read it in a book. It's a statistics, a kind of statistics. You see, more than 90% of our problems, which we think that, oh, I have a problem. Oh my God, what's going to happen? Rah, rah, rah. All these troubles, they never happen. You know, just it's all in there. It's all in there. You know, I used to call it, Dr. Yoba remembers when I said this is the radio, your radio. You have to face your radio. You know, the problem is here. It is not true. You are making it up. We are making up problems. So we need, again, we need to accept what you are in, you see, and we need to be positive. Okay, no matter what you are in, be positive. And remember, any problem we are facing, we are capable of handling it. This is for sure. We can handle it. You know, God is fair. God is fair. You know, God gives us, every one of us, a lot, his lot or her lot in life, which we can manage. Nothing above our, you know, abilities or capabilities. No, it's within our capabilities. So we can manage any kind of problems. Do you know, I remember here a verse in the Quran. I'm sure also it's in the Bible. You know, I'll tell you what we have in the Quran. It says that it's, you know, it's a deal that every one of us will face sometime loss of money, loss of loved ones, you know, and some crisis. It's everyone will in his life or in her life will come across one of these. It's ordained over all people. I'm sure in the Bible also it says something like that. Okay, and what we can do? Be patient. So patience is another very important key in dealing with mental disorder or you know, mental health or mental care, or how can we keep our mental you know, health intact. So we need to be patient. Patience pays off. Patience pays off well. You know, even if you are, as I said, even if you are in the middle of a toughest problem, if you are patient, if you accept what you are in, if you are positive, and if you are patient, surely, definitely, you will go through it. Nothing will stop you. Nothing, nothing actually will keep you from going on. And when you accept, when you are patient, and when you are positive, I'm sure these kind of keys, guys, save you from mental disorder, because you're still positive, your thinking is intact, you can think properly, you know, you haven't lost you know, this piece or up there. This is the brilliant piece, guys. God has given us this piece, You know, you have to be grateful, always grateful for this piece of thinking that we can think. You know, so as long as you are patient and you can think and you are positive, you will manage with any kind of problems, and that will help you to maintain your mental health. So, so again, we need to face our radio. People in the psychology, they give it many different names: the gremlin, the radio, and they give it very nasty names as well. So the music, and I remember here, in the book I've really I recommend for everyone, the Power of Now. I'm sure that you've read this book, The Power of Now. It's one of the best sellers. I read it like maybe more than 12 years ago. But still, when you go to any big bookshop anywhere, you find it among the bestseller. Now, in the book of Now and the Power of Now, they suggest something actually. Honestly, it needs some training. What they suggest that we need to act as a watcher. I always do like this when I in a lecture. I put my hand here. Look, you see where is my fist on top of my head? Okay, so my head has all the ego, the egotistics problems, the issues, everything. Now here you need to master some kind of control over whatever happens. So if you can manage, if you can work as a watcher, you know the word watcher? So you are watching whatever going on here. If you have this power of watching out what's going on inside your mind, you can keep your mental health always intact, always powerful, always positive. But you need to train yourself. It needs some time of training, because it can take some time that you watch out what's going on. You see, and also Dr. Yoba, remember my friend, my colleague, also Professor William, when he talks about positive self-talk. Remember Dr. Yoba? Positive self-talk. Dr. William talks about it in the lecture in Istanbul. And we need to keep sending, positive vibes to our subconscious, that we're good, I'm good. And I always teach my students in the classroom to keep sending or to keep saying this self-positive talk. And last week, one of the girls, I mean, she defied me. She said, "No, I don't believe in it. I'm not going to do it. I'm not going to do that. I don't think that it works." What do you mean? So I said, I'm good, and everything will be all will be all right. I said, come on. If you don't believe me, you just try it. Give it a try. Nothing to lose. All right. So we need to get, well, I do it myself. Whenever I am down, anyone can be down. We have our ups and downs. Anyone, we are all human beings. So if you keep, sending this positive vibes to your subconscious, and you keep this positive self-talk, I'm good, hundreds of times. Don't say 10 and oh, nothing happens, or 5 times, oh, I'm fed up, I'm bored. I said I'm good, nothing happens, nothing changes. No, you have to be persistent. You need to be persistent, guys. Listen, we're talking about mental health. This is not that an easy issue. It's a big issue. So we need to work for it. So we can, like, say 100 of times, 500 of times. So what? It will take 10 minutes. But by doing this, by sending these positive vibes and keep saying this, positive self-talk, what we do, what happens, what actually happens, we deceive our subconscious, because our subconscious is dummy. The subconscious believes us. So if you keep saying that I'm good, I am good, I'm perfectly all right, everything is perfectly good, I manage with that, I'm good. And listen, don't say I am not bad. Don't use the negative at all. You don't say that I am not bad. No, I need only affirmative. I am good. I am perfect. I am all right. Everything will be okay. I'm sure of that. I'm sure of God. I'm sure of my capability. I'm strong. I'm strong. I'm strong. I can manage. I can manage. You know, hundreds of times. Believe me, it in all these positive talks which we send to the our subconscious, you know, within time, the subconscious will believe you and will act accordingly. Now, the surprise is that more than 95% of our actions are done and run by our subconscious. Are you surprised by that? You see, more than 95% of what we do are run by our subconscious. So if we can manage to fool that subconscious that we're good, I am so good, you know, and you know when I'm sure Mr. Clement remembers that, and even in the when I do lectures to you people, you lovely people, I really I'm so blessed to see you in Istanbul and be in contact with you, of course, more often. I really enjoyed being in contact with my Nigerian beautiful people, and I keep telling them, in you know, in the lecture, guys, are we good? So remember, Mr. Clement, are we good? And you know, I hear some people say yes. I said, no, no, no. I don't want yes or no. I want you to repeat. Are we good? We're good. Are we good? We're good. So we keep repeating that we're good. You see, now we send that positive vibes to subconscious. You know, it's a kind of what? It's a kind of reprogramming our subconscious so that we can manage with what we are in. And believe me, guys, everyone has her lot in life. No one is free from problems. And you know, one of the definitions I really like about man, man is a problem carrier. We are all problem carriers. No one on earth is without a problem. But there are some people who are wise and smart and they play it right and they use their mind and they are positive and patient, you see, and they can manage even if they are in the middle of the toughest problems. I'm sure that all of you guys, and including myself, we have acquaintance of people, very beautiful people who are not that educated, but they are so wise and patient, and they manage to bring up their kids, and their kids become so successful people with little means, and they are not that rich, with what little wisdom, little patience here and there. All right. Acceptance. You look at their eye, look at their eyes, look at their faces, you see the acceptance. They are icon of acceptance. I'm sure it rings a bell. I'm sure every one of my audience, my beautiful audience tonight, when I say those people, it rings a bell. Oh, I said, oh, Mr. Ibrahim, oh, Miss X, Mr. Z. Oh my God, whenever I remember his face or her face, although she is whatever she is in, she looks peaceful and accepted, and willingly, and never complains. And that what this is the fuel, guys. We need this fuel to keep our mental health intact. And remember, I always also tell my students about the three C's. If we can maintain three C's, not doing the three C's, every single person will love us. The number one is don't complain. People don't like those people who complain. Even if you have a problem, don't complain about it. Don't talk about it. You see, because people, oh my God, I can't. No, I'm leaving. I'm going. Why? Oh, she always complains. She never stops complaining. Oh my God, I'm fed up with my own problems. Why should I listen to her complaining? You see, so don't complain. Okay, and don't criticize. Some people are really crazy about criticizing people. Okay, they do this. Oh, look at this. Look at she was doing. Oh, look. So also people don't like those who always criticize others, and don't condemn. You see, don't condemn. So don't complain, don't condemn, don't criticize. You see, all these Remind me with this person who is patient, who accepted what he is in, who is, actually he doesn't dwindle much in the past or in the future. He has this kind of content satisfaction, and he keeps, sending this positive vibes that everything will be okay. Okay, yeah, I'm sure when I say this kind of things, kid, don't worry, everything will be okay. Okay, mommy. Okay, dad, oh, please pray for me. And don't worry, son, you are gonna get it. You're gonna get the job. I'm sure this kind of words, it rings a bell. You know those people who are always smiling, satisfied, you see, patient, and hearts full of hopes. And these good words, these peaceful words, these lovely delicate words are always on their tongue. It spreads happiness and tranquility among all of us, even if we are so educated. It doesn't matter. I know people who are so educated, but they cannot do anything unless they go to their mom and dad who are not educated, and please, mom, please, dad, pray for me, pray for me. You see what I mean? We need that. Why we need these prayers? But it is a kind of positive vibes. We gain our strength from these positive vibes. So what do you think, guys, about the keywords I talked about today? Does it make sense? Does it ring a bell?
Absolutely.
Yeah, do you like it? Do you like it?
Absolutely.
So we need this. Well, Dr. Yoba, we cannot do anything except that every single one of us has her own problems. But if we accept it, and we are patient, and we are positive, okay, and remember, any problems we have, okay, we can manage with it because God is fair. God will never put us in a problem which we cannot handle. No, we can handle every single problem we are in. Okay, so even if we cannot handle it, it's a trial. It's a trial to you see, to show people, to show God that we are up to it. We are up to the moment. But we need to keep our mental health intact by doing these simple things: the positivity, the patience, the acceptance and willingness, you know, and also never complaining. And because even I'm sure, Dr. Yoba, in the Bible, you have all these beautiful things as well. That if you keep thanking, and if you keep being grateful, God will give you more. You
Yeah,
see,
sure.
but if you keep complaining and cursing and damning, you will have the same. You will have from the same sort
Yeah.
of what you're doing. But even if you're in a problem, and you keep this satisfaction, and thank God, I'm good, I'm better than millions of people. Look at so other people, you are in trouble, they are so and so. Thank God, thank God, thank you, God. Thank you for all what you give me. Okay, it's a problem, but I manage with it. This kind of self-talk helps us a lot, and you keep going, you keep moving. Isn't it,
Okay.
Dr. Yoba?
Yeah, sure, sure, sure. Trust you. Thank you so much. We're so
Well,
grateful. As usual, I know if you give you 2, 3 hours, it wouldn't just be enough for
of
you.
course, you know
Because I
me.
know that's what you know how to do best. But also, don't forget to tell us now about being hard on the problem, but
Ah,
soft
yeah,
on.
yeah, yeah, yeah. Okay, remember this beautiful
Yes,
slogan.
yes.
Yeah, be hard on be soft on the people. I always
Um,
teach this slogan, guys, in the lectures. Soft
yes,
on people, hard on the problem.
on the
So
problem. Okay,
yeah,
fine.
so the people, we have to be always soft with them. We have to show mercy, show kindness, show
Hmm.
gentleness. But the problem, yes, you can be tough with it, no problem. But if because these problems, guys, involve our beloved ones, like even like daughters, sons, parents, uncles or grandmother. It involves our loved ones. So we need to be soft with them. We need to deal with them with care and love and respect, and mercy. Don't forget, guys, mercy. We need to show mercy on them. But when it comes to the problem, yes, be tough. When it no problem, it doesn't matter. So this slogan is very important. Tough, hard on the problem, soft on the people.
Soft on the people.
Yeah.
Thank you so much. Thank you, Prof.
Most welcome,
We are so grateful to have you. It's always so informative and insightful. We appreciate you, Prof. We really do appreciate you.
Thanks so much.
At this point, we have to round up this program, because if you look at your time now, I think we are done by like 30 minutes.
Oh.
And we can't have enough. Thank you so much, Prof. We really appreciate you. And we appreciate every other person that's made contributions on this program this evening. We've learned quite a lot. And Professor Tariq has also told us how to accept our situation as it is. It's when you accept your situation that you have the willingness to look for solutions to these problems that we have. And while we are doing that, we should be patient, because patience is going to help us to be able to find the right solutions to these problems. We should never be in a hurry. And he has also said we should look for a book, which I know by tomorrow I'll begin to look for it, The Power of Now. That's very, very important, because you should always look for knowledge. Knowledge is not expensive. Ignorance is more expensive than knowledge. So when we have knowledge, we use knowledge and we become wise, and then we can navigate the turbulence of the world that we live in. So mental challenge is one of those problems that people have in the world. So once we know and we're willing, we can always find solutions to these problems. So thank you so much. We really do appreciate you for being patient and being there for us today. For all the people who have made contributions, Ajia Rukayat, Dr. Ninnah, Mr. Ben, if I'm not making a mistake, all others who have contributed their quota this evening, we really do appreciate you. But there's an assignment that we have given now, and that assignment is that we should all go out and get at least 10 people. Talk to 10 people about their mental consciousness, their mental health consciousness. Talk to 10 people. Each one of us doing that will help us. And we also advise those people we talk to talk to others, so that the message can go down. All the other parts of our existence really, really do matter. We are doing parties, we want to relax. They really, really do matter. But our mental state, our mental health condition can go a long way to determine the value we have in our lives. And if we begin to handle this very well, then we have reduction in depression, we have reduction in suicide, we have reduction in all sorts of crimes that are taking place in our society today, because all of this happen as a result of the breakdown of mental health of these individuals who commit all these things. So we need to help ourselves so that we have a better place. When you think you are okay, you think your children are okay, think about your neighbors. If you are coming out of your house and you are meeting people who have mental health disorder, they can tamper with you, and then you can even lose your life. And that's not what we want. So thank you so much. We appreciate you. In the next 2 weeks, we hope to be back on this program. But when we come back in 2 weeks' time, we want to look at some very important, points that can actually affect very important people in our society, in our lives. We are talking about the girl child. We are talking about women. The hormonal imbalance in girls during when they start having menstruation and the rest. We want to look at how this affects them mentally and what are the solutions. And also for women who are advanced in age, they get into menopause. And with this, they have a lot of menopausal disorders in the body that actually affect their mental well-being. We want to tackle this by the time we are back in 2 weeks' time. So we hope to see you then. Thank you so much. We love you all. Bye-bye. God bless you.